Hey guys, this is C. Allen, better known as Chef Panay. When I tell you I am super excited today to be in the studios, why? Because I have the man with the plan. Now listen, I'm gonna have to read it now because it's powerful. I have the chief of the George Washington University Hospital Transplant Institute and medical director of the GW Ron&Joy Kidney Center, Dr. Melancon. Let's welcome him to the show. Yes, indeed. Well, Doc, I think it is an honor and a privilege to have you here in the studio. Listen, audience, I got to tell you this before he starts talking. Well, first, let me welcome. Welcome, Doc. Welcome, Doc.
Thanks for having me, Chad.
So listen, guys, and I'm really excited. Not only do I have a million questions for him, however, I met this guy through Patrice Miles has said to me, you have to, no, I take it back. Let me go all the way back. The person in charge of the Cancer Institute, I went to her, my girl, Patricia Calthurst, and I said to Ms. Calthurst, I said, I need someone, a kidney doctor, to come on my show and talk to me about kidney disease because I'm currently on dialysis. She said to me, she said, I have the perfect person. She said, you need to call Dr. Melancon. I had him to come into the studio, and I always tell this story. I feel bad because for a whole 30 minutes, I kept on saying Dr. Melancon, because of the spelling of his name. And when we took a break, Ms. Miles came over and said, it's Melancon. So I said, oh God. I said 30 minutes went by, and I kept on calling him a different name. However, I'm really excited he's here today because guess what? To me, it's almost like a lifesaver because when I interviewed him at the Radio 1 station, he talked to me intently, but also the personality and him being the person that he is, but was so down to earth. And he literally said to me, man, if you come over to GW, to George Washington, if you come over to George Washington University Hospital, Transplant Institute, I'm telling you, we probably can get you transplanted in no time. And I'm telling you, ladies and gentlemen, I went back to the first hospital, and the first hospital raved so much about him. He wasn't even at that hospital, but the first hospital raved so much, and they said, please tell him how much we miss him and we loved him. And when they said that to me, I knew that I made the right decision by going to George Washington University Hospital Transplant Institute. So I'm excited. So I want to know, and then, and everyone know that, I'm far from being a racist, but when I saw a man of color, a brother, I really got excited. So what I want to do is I want to talk to him first. I want to know a little bit about his background and how did you become the director, the medical director at GW Ron&Joy Kidney Center. Talk to me.
First of all, I want to say it's a great pleasure to be here. You have a great place here, and I'm so proud of what you have accomplished. I'm so happy to see you doing so well because you got the gift of life. And one of the things, before I talk about myself, I want to say it's important that we understand you didn't get a kidney, you got life. Yes. You're going to live many more decades because of that gift that you received. I'm a transplant surgeon probably mostly because of my mother. My mother was a surgical nurse, and from the time I was a little tyke, I wanted to be a doctor. So I did what I needed to do to become a surgeon and eventually became a transplant surgeon because I actually had a very good friend in college who needed a transplant. And I got to see his actual operation while I was a medical student. I became the director of the Ron&Joy Kidney Center because Ron Paul is a transplant recipient like you. And we talked about what he could do for this metropolitan area. And he donated a lot of money so that we could go out and educate people about kidney disease. It's ironic because I'm a surgeon, like I did for you, I do operations, but I realize you reach a lot more people when you can go out and educate people about things like kidney disease. There's a lot of kidney disease out there, and I know we're going to talk about that today, but That's how I became the director of the Ron&Joy Kidney Center. We go out and we screen people for this disease, which is now, unfortunately, an epidemic in this country.
So then tell me, what is so special about the GW Ron and Joy Paul Kidney Center? What's so special about it?
Yeah, you know, you alluded to this earlier. I saw your program with Michelle Whitehead, who is a phenomenal nurse. And as you know, she's a part of our family at the George Washington Transplant Institute. You know, what we have there, what I have really sought to have is a family. And the family is between us, but it's also between us and the patients. So to become part of that family, you have to show us that you have a passion for taking care of people. You know, I don't know if you've ever read any of Malcolm Gladwell's books, but he has a book called Outliers. In the prologue to that book, he talks about this town. It's called Risotto, Pennsylvania. And in that town, they studied that town because people really just die of old age. They don't die of cancer, they don't die of kidney disease, they don't die of heart disease, although they live like the rest of us. What was special about that town? Well, what they found was that community, they have extended families. It's not strangers. When you have that sort of a connection to people, people not only feel better, they do better. So what you were talking about in that interview with Mrs. Whitehead is what we actually try to inculcate within our team, because guess what? It not only makes the patients better, it makes us better. And that's what's special about the George Washington Transplant Institute and the Ron&Joy Paul Kidney Center, because you know what we do? We go out in the community and we actually seek to find people that have this disease that a lot of people don't even know about. And we find it and we diagnose it, and some patients, we don't even have to operate on them. They just live longer because they start taking care of themselves.
Absolutely. So listen, so let me tell you something, and it's true. When I was first diagnosed, I went to the hospital that I normally would go to that's in my area. And it felt like it was a stoic kind of situation where, you know, you already have issues going on in your head because they're telling you have kidney failure. Then you go to a hospital, it's very cold, it's very bland. I just didn't feel comfortable. After I met you and sat with you, and when you invited me to come over to the other hospital where you were at George Washington, when I even walked in the door, the first lady came out, what's her name, the dietitian? Carolyn. Listen to me, audience, I'm telling you the truth. Carolyn came out, she was shaking, she was dancing, this Caucasian woman, she was just dancing, just shaking, and instantly, it just made, my mother was there with me, it was my first intake, and instantly it made me feel much better just off of her personality when she walked in the door. Then she challenged me. She was like, okay, so it'd be great, can you lose 20 pounds? How much pounds you think you can lose? It wasn't a stress situation, but she was just explaining to me how the surgery would go better for me if I lost more weight. Then when all the other nurses and doctors came in, it just made me feel amazing, and I already knew the answer. What was so special about it? And it's a family atmosphere that makes you feel really good, especially when you have gotten the news of kidney failure. And let me tell you on something, this is important, and we're going to get into kidney disease right now, but let me just say this. It did not really hit me, ladies and gentlemen, until I went to the Social Security building to apply for Medicaid. And when I applied for Medicare, I couldn't get Medicaid because of, you know, my salary and all that, so I had to apply for Medicare in order to get the surgery. And the lady said to me, she saw me being young and vibrant, and she was like, well, what are you here for? And when I told her my situation, what came out of her mouth was, oh, you have end-stage renal failure. Instantly, right then and there, I said, end-stage renal failure. End-stage means I'm about to die, is what I'm saying to myself. So all of a sudden, that's when the depression started to sit in, when I realized that now I'm at the end of my life, basically listening to what the lady was saying. And I think that it is crucial that we have these kind of discussions, because most people wait until it's too late. and then all of a sudden they try to figure out what's the next step. And a lot of times, because it's a silent killer, we have no clue. So, Doc, I want to start off with, what are the functions of a kidney? I mean, let's take it all the way to the bare basic so everyone can get a clear understanding today.
Sure, great question. So first and foremost, your kidney is your filter. And if that filter is not working correctly, fluid will build up on your body and toxins will build up. If your kidney's not functioning and you don't have what we call renal replacement therapy, which could be a transplant, but it could also be dialysis. If you don't get dialysis and your kidneys fail, you die, and you die pretty quickly. So that filter has to work correctly. Otherwise, all the toxins that we get from the foods that we eat build up. All the fluid that you drink and that your body produces builds up, and you feel horrible. What happens to, unfortunately, many patients that I wind up operating on is their first sign that they have kidney disease is when they feel so bad that they go to the emergency room and they are already, what you just said, end-stage renal disease. This has been going on in their body for a long time. They're just finding out because they've never been tested. They've never gone to a doctor and had blood work or had their urine tested for protein. That's what we do. We try to find out early on in the process people that might have kidney problems. But to answer your question, what does the kidney do? It has a lot of important functions. Primarily, it's a filter, but it's also an organ that produces hormones that are important for building up your blood, making you have energy. There's a lot of things your kidney does that people do not understand, but without good kidney function, you will die, plain and simple.
Okay, so can you tell me, what are the ways to avoid kidney failure or kidney disease? What are the ways to avoid it?
Well, thank you for that question, because it has become so important in my life. But the way to avoid kidney disease is to avoid the three main things that cause kidney disease. Number one, high blood pressure. Okay? High blood pressure. Number two, diabetes. And number three, obesity. These are the three main causes of kidney disease. Most people that have kidney disease have had high blood pressure for many, many years, and it has not been treated. Cherry Mialis, who's sitting over there, knows that when we go out into the community with the Ron&Joy Paul Kidney Center, I can almost bet with my team who is going to have the highest blood pressure that day. I can describe the person. And the person that usually has the highest blood pressure when we go out into the community is someone that, number one, already has a doctor, and number two, is already taking medicine. Now, you might say, well, they have a doctor and they're taking medicine? Why would they have the highest blood pressure? Well, because either they're not taking their medicine correctly, or they just believe that since they're under the care of a physician, that they're fine. But they're not fine. What everyone needs to understand is, what is high blood pressure? High blood pressure means that top number, the systolic blood pressure, is higher than 140. If it's higher than 140, you have high blood pressure. I don't care how many medicines you're taking. And if that bottom number is higher than 80, then you have high blood pressure. Again, it doesn't matter what medicines you're taking. And if you consistently have a blood pressure that's high, you will or may have problems like kidney disease. What happens a lot in doctors' offices, particularly in places where there's lots of people that have high blood pressure, they're dealing in crisis management. So people are coming in and they have blood pressure in the stroke range. So since their offices are dealing with people that have these very high blood pressures, you might come in and have a high blood pressure, but it's just a little high. So they tell you, oh yeah, your blood pressure is 150 over 90. That's okay, it's not that bad. If that means you don't have to be rushed to the hospital, but that's bad. If every day your blood pressure is 150 over 90, over time, you're gonna develop things like, we're talking about kidney disease, but also heart disease and or stroke. So a high blood pressure is bad. And that's one of the things I want people to understand. So how do you get kidney disease? High blood pressure, diabetes, usually a combination thereof, and being obese. being overweight. All of these problems in our community, we have more than we should. And that's how we have to address this epidemic.
Which is really good, which leads me to, well, first of all, and I fell in the category of all three at that time. So what leads me to my next question, why do you feel that the rates are so high in the District of Columbia?
Yes, people ask me this all the time because I talk about the prevalence of kidney disease in the District of Columbia as being, it was number one for a long time. It's now dropped to about number two, but guess why? Because so many of our people have been pushed into PG County in Southern Maryland. If you look at the area and you include Northeast, Southeast DC, PG County, and Southern Maryland, that region has the highest incidence of kidney disease in the whole country.
The country.
Why is that? Well, it's because of the fact that this city, this area is heavily African American, and then in the northeast, north central part of the city, we have a lot of Hispanic Americans. And both groups, Hispanic Americans and African Americans, have a much higher incidence of kidney disease. Why? Well, we have more of those top three issues. We have more high blood pressure, more diabetes, and more obesity. But there's also what we like to call epigenetic phenomenon. And that's just a fancy way of saying that our lifestyle, our culture, the things that we eat, eating too much salt, too much preservatives, not getting enough exercise, not drinking enough water. These are things that, unfortunately, in our culture, we have more problems with. Chet, you know, because these are some of the changes you had to make in your own lifestyle. But the main issue as to why the district has so much kidney disease is because we have a lot more African Americans than most major cities.
Very good. Okay, so this is a good portion for us to take a break, because what I want to do is when we come back from break, I want to go and dive into some questions, because a lot of our audience had questions, and then we want to just make sure that we cover everything on the gamut. So I want you guys to sit back and relax. We're going to take a commercial break, and we'll be right back after these messages. All right, guys, I'm back here live with Dr. Melancon from the George Washington University Hospital Transplant Institute and the medical director at the GW Ron&Joy Paul Kidney Center, the place where I received my treatment. So, Doc, listen, I want to go into some questions that our audience has, and I wanted to first talk about, besides suds in the toilet, I want to talk about, it says, the first question is, besides suds in the toilet, sometimes it takes me forever to pee, but the urge is there. So the urge is there to pee, but it takes a person some time before the urine comes out. Talk to me about that.
Okay, so, well, if that's a male asking that question, the first thing I would want to know is, is their prostate enlarged? So anytime there's hesitancy or your stream is not as strong as it could be a prostate problem. Now, prostate problems and kidney problems can go hand in hand because, as your kidney starts to fail, then your bladder is not being filled with urine the way it would have when you had normal kidney function. And so it can actually make a smaller prostate can feel like a larger prostate, and it can start making you have urinary hesitancy, like what he's describing. But suds in the toilet, as I've mentioned on prior shows, means that you have a lot of protein. So whenever your urine is very foamy, it means you have a lot of protein in your urine. That is bad. That's a sign of kidney failure, and you should be checked out. It's one of the things that we screen for at the Ron&Joy Paul Kidney Center when we go into the community. We take people's blood pressure, we take a sample of urine because we want to see if they have protein in their urine. That's a sign of kidney failure. Got you.
Now, I heard that crack and cocaine will really damage the kidneys. Tell us why.
Well, crack and cocaine is bad, So when you used to say crack is crack, you shouldn't be doing it. And yes, it affects all of your organs. primarily because it causes your blood pressure to go up, quite high, and then over time, abusing these drugs, it increases the tensity, the intention or the squeeze of your arteries. That's why people can have things like strokes. So crack and cocaine, which are basically two forms of the same drug, are both bad primarily because they increase your blood pressure and they increase the pressure inside of all of your organs.
Okay, so now this is a good one. I want you to talk to me about what are your feelings when it comes to holistic doctors, because, and this is a true story, one of my, she's a graduate now, but one of my students, her partner, came up to me one day and said to me, I'm going through the same thing you're going through, but I'm going to go the holistic route. Needless to say, she died within a year. So my question is, and I know when I first found out, I went straight to Google and I started reading everything and I started trying to figure out what could I do to avoid dialysis. And a lot of people were saying, I wouldn't do it. I will go to a holistic doctor. So what is your take on that?
Yeah, so first of all, what I want to have people understand is, I'm not against holistic medicine. For a matter of fact, it's medicine, right? So all medicine comes from herbs and flowers and plants. So that's true for all medicine. I'm not against it, but I do have a personal story. I don't know if I've told you before, but my mother, who is a nurse, decided to take holistic medicine instead of taking the traditional blood pressure medicine and eventually had a heart attack. So I believe it's okay to take holistic medicine, but really the best thing for you is to go to an allopathic physician, and that allopathic physician can work in conjuncture or as a team with your holistic doctor. Some of the things that you would take holistically, first of all, may not work correctly. It could, but it may not, and it may interact with the other medicines. This is particularly true in transplant patients because the medicines could interact. But I'm not against it, but I do believe that allopathic medicine, which is the typical Western medicine, you should still be pursuing that when you have something serious like high blood pressure, diabetes, or kidney disease.
Okay, so the next question is, why is my mom so weak after dialysis?
Yes, this is a very, very common thing because, your kidney, when it's working, it's a constant thing. It's just working 24/7. You don't even have to think about it. We do dialysis the way we do in this country because it has to be measured out to be given to so many people that need it, and this has to be done feasibly. So when you go to dialysis, they're trying to get a lot of fluid off of you in a short period of time. It's not working like your kidney would normally work. And so when they pull all of this fluid quickly out of your body, it makes you tired. It can drop your blood pressure. It can weaken you. So that's why people will feel weaker after dialysis. You would be better off if they don't have to pull so much fluid. Now, as you know, because you were a dialysis patient for a period of time, the way you do that is not drinking a lot between dialysis sessions. So that's why it's hard for us sometimes on the post-transplant side to deal with people that have been told you shouldn't drink too much fluid, because after transplant we want you drinking a lot. I have my water right here. So people that don't have kidney disease should drink a lot of water. But if you have kidney disease and you're on dialysis, you really shouldn't, because the more fluid they have to pull off, the more you're going to be fatigued at the end of the session.
Okay, my final question for this segment, then we're going to open it up to the audience, and that is, if I stop going to dialysis on my own, what will happen?
You will die. So if you need dialysis and you don't go to dialysis, you will die usually within 48 to 72 hours if you have no kidney function at all, which many people on dialysis have no kidney function, meaning that they don't make urine. So it's plain and simple. If you need dialysis, you don't have kidney function, and you stop going, you will die. Now, there are some people that have residual kidney function. So although they're on dialysis, they still make a little bit of urine. They would last a bit longer, but plain and simple, if your doctor has you on dialysis, it's because your kidneys are not working well. If you don't go to dialysis, you will die.
Now, and listen, and I know we're going to go to the audience, but listen, now they tell me that, well, let me ask, do doctors make money off of patients on the dialysis machine? I've been hearing that a lot, so I'm going to close with that one, then go to the audience. Talk to me.
Plain and simple, dialysis is a multi-billion-dollar industry, okay? So yes, doctors make money, but more so, the corporations that own these dialysis centers make a lot of money. You know, I joke sometimes a little, you know, trying to be ironic, that even in poor areas, that the one thing you can find is a brand new dialysis center. And because people that have end-stage kidney disease, their care is underwritten by the government. It doesn't matter who you are. The care for people that need dialysis is underwritten, meaning it's paid for. And given that it's paid for, there's always a check to go to someone. That's why these centers, no matter where they are, will make money. You could just have crossed the border, come into this country and have no status. We will pay. The federal government pays for them to have dialysis. So yes, people make a lot of money off of dialysis. The country has recently done a lot to try to disincentivize what used to happen, which is it was really against the doctor's financial interest to send you to get a transplant rather than keep you on dialysis. So yes, there's a lot of money made off of dialysis. I shouldn't give the impression that that's horrible, because what it means is in this country we keep people alive with kidney disease. If you go outside the United States, particularly a third world country, people die when they have kidney disease because it's very expensive to get dialysis care, but we routinely give it to people in this country.
Awesome. At this time we're going to open up the floor to see if we have any questions from the audience. Do we have any questions? Yes, can you go to the microphone, please? I want you to start off by telling us your name, and then you can give us your question.
My name is Jacob Neal. My question is, how long does it take to get on the kidneys list after you're free and clear of cancer?
It's a great question, Jacob. So you are correct in intimating that if you have cancer, it's usually not okay to get a transplant, because the medicine that we give to keep your transplant alive would make your cancer grow. So most cancers, and you can't put them all into one category, but for most cancers, if you've had cancer, if you are free and clear of the cancer for at least 1 year, then you usually will qualify to be able to get onto a transplant list.
All right, thank you.
Thank you, Jacob.
All right, so we have another question. You want to come up and give us your name and tell us your question.
Hello, my name is Trey Smith. I was wondering, what is the youngest patient that you have that's been on dialysis?
Thank you, Trey. So the youngest patient that's ever had to be placed on dialysis, we routinely will use dialysis even in pediatric patients. So a child can be born with kidney problems and need to be placed on dialysis immediately. So as young as 1 month.
Thank you.
All right, so we're going to take one more question from the audience. Do we have a question? If so, please state your name and your question for the doctor.
Hi, my name is Soraya Carter. I have a question about life expectancy after you receive a transplant. What is the typical life expectancy after you receive your transplant and you're taking your medication and you're fairly a healthier candidate?
Yes, Talia, it's a very, very good question. And it's what I was speaking about earlier when I was talking about how great Chet looks, because he got the gift of life. And what I meant by that was, if you look at the normal life expectancy when you're sitting on dialysis, it's taking all comers, it's only about somewhere between 4 and 10 years. So the average life expectancy is only about 5 to 6 years on dialysis. Once you get a transplant, particularly a live donor transplant, and everything goes well, you can live 20 to 30 years longer than that. So many, many decades. A normal person that gets a transplant that works well can have a normal life expectancy. So you take someone like Chet, he now has the life expectancy of other people at his age in the general public.
Thank you.
Thank you.
Well, thank you so much, guys, for being here today. We are just really excited to have Dr. Melancon here in the studios. We have to go at this time. However, we're going to come back on the next show with the doctor so we can continue what we started today. The goal, again, is educating our people in reference to kidney disease. I'll see you next time.